Good afternoon, ladies and gentlemen. Thank you for coming to this press briefing. My name is Jeffrey Lieberman, and I'm the president of the American Psychiatric Association and a professor and chairman of psychiatry at Columbia University. I want to mention who's sitting at the dais with me, which is Paul Summergrad, psychiatrist, who's president-elect of the American Psychiatric Association, Jeff Borenstein, who's a psychiatrist from New York City, who's the chair of the Council on Communications and the editor of Psych News of the APA, and Jay Scully, who is the CEO and medical director of the American Psychiatric Association. Also on my left is former Congressman Patrick Kennedy, who is a leading spokesperson and advocate for mental health care, for mental illness and addictions in the country, and is helping the APA in terms of its efforts to try and provide better mental health care to the citizens of the United States. I would also recognize John McAfee, who's in the audience from the JED Foundation, a private nonprofit organization dedicated to youth mental health and suicide prevention. Anybody else that I'm supposed to recognize? Anybody want to be recognized? So we are here today in the aftermath of the White House Conference on Mental Health, which we just attended, and want to extend our great appreciation and compliments to President Obama, Vice President Biden, the administration for convening this event today, focusing attention on the urgent and important need to provide mental health care to the people of the United States and to focus attention in a way that provides care and better access, but also helps to dissipate the historical phenomenon of stigma, which has been such a deterrent for people understanding and then being able to access mental health care. The administration, led by Vice President Biden, has been focusing on this for some time, but particularly in the wake of recent civilian tragedies that have occurred that may have involved individuals who may have suffered from mental illness. The reality is that so many problems in our society, in the world, and particularly in the area of human biology and disease, must await the discovery of new knowledge to solve the mysteries of cancer, AIDS, other types of healthcare problems. But with regard to mental health care, although there is a big job to be done to understand the brain and how it underpins disturbances in mental function and behavior, the reality is that we have more than enough knowledge to make tremendous differences in the quality of life and in the cost effectiveness of health care if we just provide mental health care in the way that we know to do it. And the APA is committed to doing that, and in association with the other professional organizations that are disciplines within the field of mental health care. And today's event really helps to focus media attention, helps to galvanize efforts, and it helps to launch specific initiatives that the President and Vice President Obama have outlined to specifically address what is really a major health care disparity. So the good news is that we can do things right now if there's the social and political will to do it. The less good news is the fact that this has historically been given short shrift and has been neglected, and that obstacles like stigma, lack of awareness, fear, and lack of funding have prevented us from doing this. But we hope that this milestone will signal a tipping point in which momentum will be galvanized and that we'll be able to move forward effectively. And one of the things that really is a major element in this process is the legislation for the Affordable Care Act, combined with the previous legislation for mental health parity that was passed in 2008. In 2008, with the leadership of Congressman Kennedy and Congressman Ramstad and his father in the Senate, Congressman Edward Kennedy. So I wanted to thank people for coming to listen to these additional comments in support of the administration's conference today. And I want to recognize my colleague, Dr. James Scully, the CEO of the American Psychiatric Association, to say a few comments before the rest of the speakers make comments.
Thank you, Dr. Lieberman. Yes, to follow along, in addition to the great promise and excitement of discoveries and new science that will help us really do a better job. And we need those, and the brain is the most complicated organ by far and the hardest to access, and those efforts are underway, and they're incredibly exciting and promising. We need to change the way we pay for and deliver care, and we've been very involved with that, and we hope this will, again, put emphasis behind the changes needed to get the care that we know we can deliver to the people who need it. We do need to change some of the systems of delivery of how we do that, and particularly working with our colleagues in the rest of medicine and healthcare in what's called integrated care, so that mental health care is fully integrated into all health care. As we say, there's no health without mental health, and there's ways to do that better than we have now. They also require changes in the payment systems for how that can be compensated, so we can get our mental health experts and professionals into the primary care fields and do that properly. And we've been working on that, and we hope that working with the administration and Medicare and the insurance companies, we can move forward with true parity, not only in payment, but in the care of people who are suffering.
So it's my pleasure now to ask Patrick Kennedy to make some comments. Patrick?
Thank you, Jeff. And I was excited today, I think, as all Americans should be excited, if they have a family member or a friend who's suffering in silence. That silence was broken today when the President of the United States said that mental health should be treated like the rest of physical health. And when the President of the United States said the brain is part of the body, and when the President of the United States said we wouldn't expect to wait to treat cancer when it got really to stage 4, we would treat it right off the top and we try to prevent it from ever occurring. Why don't we treat brain issues the same way? I mean, I can't really say it any better than the President of the United States said it today. If you treat diabetics with primary care, secondary, tertiary care, why not treat depression and addiction? If you treat heart attacks, why don't we treat psychosis? And I really want to salute the American Psychiatric Association, which is the real hub of the science around mental health. And what we need to understand is these are physical health issues. And ultimately, we need medicine to treat the brain the way we expect medicine to already treat every other organ of the body. And so I had the great honor of working with my late father, Senator Pete Domenici, my good friend and colleague, Congressman Jim Ramstad, in passing the Mental Health Parity and Addiction Equity Act. And as President Lieberman said, that was passed in 2008, and yet we still don't have the final rule which defines what that implementation of that federal law should look like. And so today was a very important milestone, because today we also got to communicate to the White House and their leadership that when the final rule is delivered by Secretary Sebelius and the other agencies within the federal government that are going to issue the final rule, including Department of Labor and the like, that when that rule is released, we want it to make sure that it has the necessary requirements for us to measure whether health insurance companies are properly following the federal law. So it's one thing to say that you're doing mental health. It's another thing to make sure we can measure. And now that we're hearing everyone talk about metrics and evidence base, well, if we're going to measure that, we should be measuring compliance by the insurance companies in terms of measuring whether they impose any higher treatment limitations or financial limitations on brain-related illnesses when compared with other physical illnesses. So in the legislation, we have 6 categories of care: inpatient, outpatient, in-network, out-of-network, in both those cases, pharmacy and emergency care. if you provide along those 6 categories of care, primary care, secondary care, and tertiary care for diabetes, then you must, under the law, provide the same care across all the spectrum of health care for brain-related illnesses. This isn't complicated. And what we need to do is make sure that we are very straightforward and have a very simple message, and that is we want equality. There's been a lot of great advancement on other areas of civil rights, marriage equality, equal pay for women, equality. And that's what we want for mental health, equality, because the brain is part of the body, as the presidents say. Why on earth do we not pay for primary care, secondary, and tertiary levels of care for the brain like we would if you had cancer or a heart disease? It's unbelievable. We live in this year, 2013, and we still don't have it as accepted practice that illnesses of the brain need to be treated equally as other physical illnesses. That is the aha moment that we had today. But to follow that up and to see that actually have some strength of action and not just words, we want a rule to be released by the White House that puts into practice all the great words that were spoken today. So if the President of the United States says, yes, it is part of the body, it needs to be treated like every other, then we expect there to be a final rule that not only covers those 6 categories of care equally for brain health as it would every other physical health, but we also expect there to be public disclosure requirements on the part of insurance companies so that those that may be less willing to treat these illnesses equally will now have a motivation. And what is that motivation? Public oversight. We're only going to be able to get public oversight if we have public disclosure. So what is public disclosure? It means that we're not going to rely on insurance companies to volunteer whether they're complying with parity. We're going to require that they produce all their medical necessity determination criteria and decisions so that we can compare whether they have imposed any harsher treatment limitations for mental illnesses as compared with other physical illnesses. It's pretty easy to compare if you have the information. But as someone may have suggested, if we don't require the information, they won't have to cover their tracks because they won't have any tracks to cover. And my belief in public life is that if you have the sunshine laws and public disclosure, you automatically accelerate compliance because people don't want to look like they're discriminating. But if this is in the dark, if this is hidden, then that feeds the opportunity for people who may not be interested so much in approving a particular treatment to think twice about whether they deny it if they know that it's needed, because now they know someone's looking over their shoulder. We've had enough people have to look over the shoulders of our clinicians. In fact, the notion that they spent so many years in medical school and developed such an expertise in mental health care only to have those decisions, clinical decisions, called into question by insurance adjusters who have no idea or training in terms of their business and yet managing their business without that knowledge. It's shocking. It's actually shocking. So I just want to say, the leadership of the APA to lead that scientific discussion, because from that we can be able to navigate what are the kinds of clinical decisions that have the evidence base in medical evidence. That only comes from the APA because they had the biological and medical and scientific understanding of these illnesses that will ultimately mean that they're going to be treated in our medical system on par as the rest of medical care. If these issues become debatable as, social issues alone, we're going to lose our opportunity to achieve full equality with other physical health issues, because then they'll simply be dismissed as, oh, all you need is some social intervention, not some medical intervention. And I think if that happens, we ruin our opportunity for full equality, and we fail to achieve eradication of stigma, because now these issues will no longer be looked at as the medical issues that they really are, but really only something that needs like some kind of social intervention, which would minimize people's thinking that this is a real issue as opposed to a medical issue, which is what it is, and which the President so eloquently stated as such in his remarks today. So I want to thank both the President, the Vice President, and Secretary Sebelius, but I also want to say that we look forward to working with them to make sure that the medical issues are treated as equal issues when discussing the issue of mental health with the implementation of the Mental Health Parity and Addiction Equity Act moving forward. Thank you, Jeff.
Thank you very much, Patrick. Now I'd like to ask Dr. Summergrad to share some comments with you.
So I'm Paul Summergrad. I'm the president-elect of the American Psychiatric Association, and I'll be brief. First, I want to thank the president and the vice president for hosting this very important conference today. Their remarks, both the presidents and the vice presidents, were extraordinary, were heartfelt, and spoke to the need to really move forward, not just in regard to stigma, which is a very, very important problem, but to make sure that we achieve full parity and equality in care for individuals who have mental health issues of various kinds. Every day in this country, there are parents and children, brothers and sisters, husbands and wives, who worry about the people that they love, who worry about the care that they can get, who worry when they bring them to an emergency room whether or not they're going to be blocked from getting that care by a level of intrusive oversight and review of the kind that Congressman Kennedy described. When people come to an emergency room and they're having a heart attack, nobody asks a lot of questions. They go upstairs and they get the care that they need. And people who have a serious psychotic illness, people who are profoundly depressed, people who've made serious suicide attempts, individuals who've had complications of substance use should not have to go through a set of third-degree kinds of questions, which makes it sound like there's something unreal or inappropriate about the care that they and their doctors think that they need to have. Doctors, nurses, psychiatric physicians need to be making those decisions on behalf of their patients. And the interpenetration of these illnesses with workforce, with schools, with jail costs, with emergency room costs, with medical and surgical costs, the early death rate of individuals who have serious psychiatric illness who die 10, 15, 20 years younger than individuals who don't have these illnesses mean that we have to create an integrated, coherent, and equal system of care. And that's really what the parity issue that Congressman Kennedy and his late father, Senator Kennedy, fought so valiantly for. And we hope to work closely with the administration. The time is now to fully deliver on this promise. It's been 5 years since the act was passed. The final rules are critical to the appropriate implementation of the Affordable Care Act and to healthcare exchanges. And there are millions of Americans and their families who are sitting up at night worrying about people that they love and care about. And we need to make sure that we can do what we need to do to be able to care for them, reduce their suffering, and return them to full health and well-being. Thank you.
Thank you very much, Paul. I'd like to open up for questions.
I might add to Paul's point, not only millions of families, but many of those families are veteran families. So another reason why we need this parity is for our patriots, because we've already heard the challenges in the VA to provide enough resources to meet their needs. Many more veterans will never go to the VA because they can't, their wounds of war, their signature wounds of war, traumatic brain injury and post-traumatic stress, are not visible on the outside. And yet when those wounds manifest themselves, when they go to their employer-sponsored health insurance, we cannot tolerate in this country them being denied medical treatment for the signature wound of war because those quote-unquote mental health issues are not covered on par with other physical health issues by their insurance carrier. So this is really the heart of the issue, is where the rubber meets the road, is this new era of healthcare reform and ensuring that mental health is treated the same as all other physical health issues.
Yes, Elizabeth?
Dr. Lieberman, could you please comment on APA's legal actions regarding parity? Question on the mic, please. Could you please comment on APA's legal actions regarding parity?
Let me ask Dr. Scully to answer that question.
We've been in discussions for a long time since it started, but particularly this past year with insurance companies who have not been following the parity rules, and those have been difficult. And we have instigated a lawsuit against one of the insurance companies that has caused them to wish to speak with us to see if we can negotiate and settle the concerns. It's clearly been as bad or worse than Congressman Kennedy was talking about in terms of their just blatant disregard of what the laws are and treating the patients with who needed help and not getting it for them, so that in many cases they've had to drop out of care. And we've had a wonderful patient in Connecticut who's come forward as a plaintiff along with a treating psychiatrist. And we're in negotiations now, and we've gotten the attention of the insurance companies and indeed those who want to not be listed as non-cooperating. All of those discussions are underway right now, so I can't really say much more. When you get into legal cases, you have to be careful.
But I will say, as far as consumers, every consumer feels isolated. And when they're denied treatment and care, they're very unlikely to appeal. But if they know they're not alone, and if they know that what's happening to them has happened to others in their neighborhood and in other states, there's going to be power to the people who can now know that they have a vehicle to seek redress under our legal system. And so this burgeoning consumer activism within the mental health community, now with the White House signal and real leadership, means that these lawsuits, class action lawsuits, ought to be on the forefront of every insurance adjuster and executor's minds when determining health policy within their insurance network, because now they can no longer just deny and then settle and then keep it secret so that no one knows that they also have been discriminated against like many others. We want this to be public because the public light of day is going to help be the best way of cleaning up these old dark secrets and old dark practices of denying either the illness or denying the treatment of those illnesses.
Could I just make a point? The president said that people shouldn't suffer in silence, and I think that's an important point that we need to reiterate. And we use the word stigma, but that's too soft of a word. It really is discrimination and prejudice. And we don't tolerate discrimination in this country anymore when it comes to other areas that historically we allowed discrimination. And we should no longer tolerate such discrimination for people who have mental illnesses. And that's why people should not suffer in silence. And if somebody feels that they are not getting the treatment that they deserve under the law, they should pursue that.
So just to amplify a bit on the comments, the big concern to this country, I mean, after national defense, the biggest concern of the government in our country is the economy. The biggest concern in terms of our economy are the rising expenditure of healthcare services. Because of this, there has been efforts that have occurred largely through market practices to contain costs. And one of the instruments that's been used to do this are the kinds of practices, whether it's managed care or prior approval, that Congressman Kennedy and Dr. Scully were referring to, which are very intrusive across all of medicine. It's not just mental health care and psychiatrists, all of medicine is affected. But when healthcare in general gets a cold, psychiatry gets pneumonia, and we get the brunt of it. Our patients who suffer from mental illnesses get the more severe impact. And that is what has happened. And in the context of parity, which the legislation in 2008 in principle established, but not in practice, we would like to see an implementation of a final rule with elements that can prevent any type of non-compliance with what is now federal law. And the conference today at the White House really calls attention to the need for this more now than ever. It's interesting. Stigma, what Dr. Borenstein referred to in its naked, more raw term, discrimination, which is what it is, has historically been applied to mental illness. Now, because of what we understand about the brain, the way it affects behavior, the ability of treatments to prevent this, we have the ability to alleviate that. But the historical prejudice and lack of awareness sort of stands in our way, and there's no reason for that to be done. The practice of good mental health care, and the saying that's throughout medicine is there's no health care without mental health care. The secret to being able to provide cost-effective mental health care is to have adequate mental health care as part of it. A noted economist that I was listening to recently said the secret sauce for healthcare reform and cost effectiveness is really providing good mental health care, and we have an opportunity to do it now. We just need to persevere, muster the political will, and as an important aspect of it, ensure that all third-party payers are compliant with that. Yes?
How do we make sure that the association... Could you speak into the mic, please? Thank you. I'm Rhonda Maddox, and I've had an interest in media and violence as it affects mental health. How do we make sure, as an organization systematically, that the recent violence is not systematically associated with people who have mental illness, and thereby almost legitimizing some of the discrimination that happens from people with mental illness? We know as scientists that people who have mental illness are more likely to be victims of crime as opposed to commit crime. But how do we make sure that that message gets out into the public in a systematic way such that legislators and other people who are making those decisions realize that and don't discriminate?
Right. Well, that's, I think, an important issue, because in the recent series of events that have focused attention on violence and potential associations with mental illness, gun control and violence have been conflated with mental illness in a way that's unfortunate and inappropriate. The reality is that persons with mental illness account for a very small proportion of the violence that occurs in the United States. The actual figure is 4%. So the vast majority of the violent incidents are either crimes of self-aggrandizement, robbery, crimes of passion, but it's only some small number of events that attract tremendous media attention where an individual may suffer from an illness or be suspected from suffering that gets the tremendous media attention. the reality is that in cases where there is an individual who's involved that does suffer, let's take the example of Jared Lochner, who clearly has been diagnosed in a way which is high degree of certainty to have suffered from schizophrenia. He was never diagnosed or treated. He had been ill for a number of years in plain sight of his family, of his community, of his classmates, and nothing was done. He sat in his class day in and day out, acting weird, saying things that were kind of inappropriate and didn't make sense, and people either were afraid of him, or they avoided him, or they made fun of him. If he had started choking, if he had fainted, if he had gotten short of breath, if he had had a convulsion, people would have rushed to his side, asked him how they can help, is anything wrong, called 911, but instead they called campus security to get him off campus. So if mental health care had been provided in a way that provided access, was proactive, such extreme complications like somebody impelled by their symptoms, becoming violent and hurting others, could have been avoided. But this is a problem, I think, in terms of the media's portrayal, and Dr. Borenstein has had quite a bit of experience with this, haven't you, Jeff?
I think that's a very important issue as to how the media, both entertainment and the news media, presents issues related to psychiatry. And an example that I cite is when the media, including major newspapers, refer to politicians as having, quote unquote, a schizophrenic attitude towards some issue. And what they mean is that they have a mixed view about it. Well, it would be unacceptable for the media to say that a politician has a diabetic attitude towards an issue. It just would not happen in a million years. Or the politician is having an HIV positive attitude towards an issue. It wouldn't be accepted. So that's one area. And another is in the entertainment field, where we could have movies that portray issues related to psychiatry in a very positive way, such as Silver Lining Playbook, and Bradley Cooper was at the White House event today and spoke very eloquently about these issues. Or we could have these movies or TV shows that inappropriately show somebody who is psychiatric without a clear-cut diagnosis, but they make it clear psychiatric, doing inappropriate violent behaviors, which increases that prejudice. So I think it's important that we, as professionals, that advocates, patients and their families, and hopefully more people in the media, in the press, in entertainment, speak out and stop this prejudice.
I want to add just one point, because I think this is a very, very important topic. And I just want to make a couple of points. One is there's an acceptance and a tolerance of language about mental health concerns on television and other settings where somebody can go on television, well-meaning, well-intentioned, good people, and will describe somebody as a whack job. That's not acceptable. And we ought to be restraining ourselves from those kinds of comments. Number one, we don't know a lot about the individuals who may be involved. Secondly, it's really the media can be extraordinarily helpful around this because it's really important to be as precise as we possibly can. I used the example recently with someone. I said, when Steve Jobs was dying, we didn't say in the media, Steve Jobs, terrible, he's dying from a physical illness. We said he's dying from cancer. And we didn't just say he's dying from cancer. We said he's dying from pancreatic cancer. And actually, if we were really good, we said he was dying from a rare neuroendocrine form of pancreatic cancer. When we talk about folks who have mental health concerns, and again, this is not some folks that are out there. These are all of our friends, families, and loved ones. We're talking about kids who have attention deficit disorder. We're talking about young women who have eating disorders. We're talking about moms who have postpartum depressions. We're talking about folks who have mood disorders and substance use problems. And yes, we're talking about people who have schizophrenia or other psychotic illness. But we ought to be as clear, as precise, and as helpful in those kind of discussions and descriptions as we possibly can. Because if not, it just puts the whole thing into one big mix, and it becomes, I think, it doesn't serve either the public or advancing a discussion.
And just to make one final comment, I think that to the extent that there are violent episodes in which persons with mental illness are involved, it almost invariably is because they have not received treatment, or they've received but dropped out of treatment, or it's not been sustained for a variety of reasons. And the bottom line is for the relatively small contribution that individuals with mental illness may make to our statistics about violent behavior in our society, this is almost wholly preventable if there was more comprehensive treatment that was available. Did you have a follow-up question?
I had a comment as it relates to SAMHSA doing the Voice Awards. I wanted to just say that they spend effort at identifying programs that actually highlight positive messages about mental health. I worked with, when I was at UCLA, University of California, Los Angeles, worked as a medical media consultant with Hollywood and Health Society, and we did 6 episodes on Beverly Hills 90210, where we identified a character who had bipolar disorder, and they received, that group received the Voice Award. But we had so many people who then went to SAMHSA and evaluated, and looked at how do you determine you have bipolar disorder and all of that. And so to be able to partner with groups like CDC, SAMHSA, to get that information out. But in addition to that, to be able to do like what APA does now when we see, legislation that's coming forth that adversely impacts psychiatrists, to be able to have a place to where we can say, hey, this was on this program, this was on this popular sitcom. It was very controversial, it was very derogatory, and let's, as a group, make sure that we put pressure on those types of organizations who are negatively displaying stereotypes of mental illness. I think that would be a good start, in instances, just for us to have a place to go to and maybe have a template letter to say, we saw this on Beverly Hills 90210. It was very negative. We don't appreciate it as an organization representing da-da-da. But in any event, that was my comment. Thank you.
I think it's certainly portraying mental illness in unfavorable and misleading ways. It's also presenting psychiatrists and mental health care providers. Jeff mentioned Side Effects, or Silver Lining Playbook. There was also in the same year a movie, Side Effects. I don't know if people have seen this. It was a great movie. Director is a very talented director. But in the interest of making an entertainment suspense film, he completely exploited the field of mental illness, the patients with mental illness in the field of psychiatry. I mean, the script just about hit every sort of misleading myth and distortion that one could have fed to the public, which has the effect of discrediting or undermining the credibility of the profession and discouraging people from seeking help. And it's particularly damaging when it comes to mental health care and mental illness, because no other field of medicine, no other discipline of medicine has an anti-movement. You don't see an anti-cardiology movement or an anti-orthopedics movement, but you do see anti-psychiatry movements, particularly led by organizations such as Scientology.
Absolutely.
Other questions? Yes, Dr. Levin.
Could you maybe discuss a little how the health benefits exchange boards may bring parity for mental health in line with primary care?
I'm going to ask Congressman Kennedy to comment on that.
Well, this is a formative time for implementation. And so, just as we've been talking about today, having an ability to represent what's the science to these boards that are making these important decisions that will have enormous implications on what gets covered and what doesn't get covered is so crucial. And having family members who are mental health consumers and their families also testify, because politics is such that if you're not heard or seen, you don't count. And one of the tragic consequences of stigma is that we don't have a political voice at the right places. And one of the most important places we need a voice is in these health exchanges as they begin to draft the architecture of what a health exchange will look like. Of course, we're benefited by the fact that it's one of the 10 essential health benefits need to be in every insurance policy sold, mental health and substance abuse. But we don't know exactly what services are going to be provided in order to fulfill that mandate. And I can tell you, we can have part of the message come from the feds through final rule, but another part of the message is going to come from these states and from consumers who show up at their local kind of capital, state capital, or health office, or insurance commissioner's office, and exchange meeting, and testify. Because I guarantee you, folks from other physical illnesses are going to be there. And if the regulators are not seeing faces and voices of recovery, are not seeing consumer families, believe me, they've got enough pressure on them to move in other directions. We need to hold them and keep them towards this direction because it helps every other physical health issue. I mean, we are the great leverager of healthcare. If you treat mental health properly, you get all kinds of results for cardiovascular disease, diabetes, cancer. Everything can be related to this in a very powerful way. But that needs a voice. So this is an important time for APA to be helping to convene that discussion amongst both consumers and other physical health physician or organizations so that they understand it's important to them that these benefits be generous and be comprehensive in their application in the local health exchange and the way those exchanges are going to describe what is offered by the local insurance community.
Jada, did you want to comment further on that?
It's not just the right thing to do, it's the smart thing to do. We have robust data now that people suffering from the core standard chronic illnesses in America, arthritis, heart disease, hypertension, cancer, or et cetera, if they have an additional psychiatric disorder, the cost of their health care, not their treatment for their psychiatric disorder, goes up to the tune, extrapolated nationally, to somewhere around $240 billion extra cost for treating their arthritis, cancer, heart disease, if they have an untreated mental health problem, a psychiatric disorder such as depression, the most common one, or undiagnosed and treated substance abuse. Paul knows all about this. But this is now data that's there. So if you want to save money, and you do this, you got to cover these treatments and do it right. We may need to do it in different ways, as I was saying earlier, to be on a team, an integrated team with the primary care folks who are doing that, have mental health professionals, but there's ways to do this that are going to help bend the cost curve down, actually.
About 55 to 60% of all mental health services are actually provided by general physicians for a whole variety of reasons. Some folks don't want to see mental health providers, psychiatrists, or other mental health providers. Some folks see folks, their general physicians within the context of their other medical care. Lots of folks don't get evaluated and cared for, and lots of folks don't get the appropriate care that they need, but a lot of that care is happening in the general medical environment. At the same time, as Dr. Scully mentions, there's lots of indications, especially for people who have combined mental health and medical illness, or mental health substance use and medical illness, that their medical care costs are significantly higher, and that there are some ways that we and others with good research have found to provide more integrated and collaborative care. My sense is, and I can't prove it, but it's a strong sense, that we're never really going to wrap our arms around the issues of mental health, of healthcare reform, and really getting control over totality of costs in the total medical environment unless we really embrace people who have mental health and substance use disorders rather than pushing them away. And the approach and the tactic of doing that as a way of saving insurance costs it's not right, and it's failed as a strategy, both from a healthcare quality outcome and from a cost outcome, and it's just the wrong way to go.
Eve?
We've talked a lot about mental health services in the private sector, which I think is very, very important. But attending the White House meeting this morning, did you feel that there is a commitment on the part of the administration in terms of reversing some of the budget cuts that have devastated federal and on down to state and community level services. Do you feel that there is a light at the end of the tunnel in the current funding climate with sequestration and the focus on cost cutting?
Well, I think that's probably going to be an important factor to determining sort of the success or failure with this initiative. So there's no specific aspect of the proposal to provide increased funding that would reduce the budget reductions in state mental health care systems. The initiatives that were announced really are targeting schools, targeting youth, targeting populations that are known to be at risk for mental disorders in a way that's very proactive and would be very effective. But in terms of the budget cuts and the reduction in the scope of services that have occurred nationally, on a state-by-state basis, there's not a specific plan as to how those could be restored or addressed. Beyond that, the Healthcare Reform Initiative, the Affordable Care Act, will provide a new way of financing health care that will affect the healthcare delivery system, including mental health care. And in this way, it'll provide a portal of entry for services that previously may have been supported by public mental health systems at the state level. But exactly how this is going to be orchestrated remains to be determined. But a major priority that the APA has established is to actively be involved in the definition of what are the optimal models of integrated care, mental health care service delivery, and the reimbursement schemes that will develop in the context of this healthcare reform process. Other questions? Final comments? Thank you very much for your attendance.